afternoon. My name is Rachel Vernon, and I'm going to be doing a presentation on my research proposal regarding hospital-acquired infection. This is going on in a hospital in southwestern Pennsylvania, and we'll be doing the study over a 30-day period. And my goals with this is prevention. I'll be going through all this information as we go through the presentation. But I first want to go into what hospital-acquired infections are. And basically, what hospital-acquired infections are something that happen to patients in the hospital that are not related to their original diagnosis of coming into the hospital. Examples of these would be urinary tract infections. These could be just from catheter associated. There also could be ventilator associated pneumonia. And then another example of this would be centralized bloodstream infections, and that would be from an insertion from an IV or a central line, where people get infections from these, and again, this was not their original diagnosis. Does that make sense to you?
Yes.
Okay. So, and like I said before, those are three of the most popular or the most common associated infections that happen in hospitals worldwide. We have two things we're going to review for my research proposal. One will be the statement of the problem. The reason why I'm doing this is because people are getting infections non-related to why they came in, and the reason being, and we'll get through this later on in the discussion, mostly from nurses or healthcare workers not performing proper hand hygiene or sterile techniques when doing this, when doing these procedures, or in general with patients. Okay, people shouldn't be getting these infections, and I want to try to find a way to fix this from happening in hospitals. My statement of purpose goes again with the statement of the problem, finding a way that they are happening and how we can reduce them. And my main finding is prevention measures, and that is my purpose with my whole research proposal is prevention measures to reducing them in hospitals. And mostly I'm doing this in the hospital in southwestern Pennsylvania. We're doing a very small study. Key terms, this is important for you all to understand. Non-synovial infections are the same thing as a hospital-acquired infection, and the definition of that is related to hospital. A few of the other terms, urinary tract infections. This is caused by an infection, any part of the urinary tract. And this normally happens when catheters are inserted into patients where the infection lies and people get urinary tract infections. Most of the time, insertion or just keeping them in and using sterile technique and cleaning them properly. So that is one key term that I want to keep to your attention, because we'll be discussing that because that's one of the most common in hospitals. And those, like I said, happen normally from Foley catheters. Pneumonia, it's another thing that it's inflammation of the lungs. This can happen when they are ventilated. You can get ventilator-associated pneumonia, and that's just not getting proper care with their ventilator that they have in the hospital. And two of the other terms I want everyone to understand is sterilization. This is because this is what the hospital needs to do to better prevent these from happening, and we'll get to that later in the discussion. And then prevention is my main goal with this project, and that's the action as to avoid or a conclusion or a phenomenon. So there was about 4 articles that I have received offline, scholarly articles that I felt that were important in my research proposal. Ecrinaud did a study on the association between age, sex, and hospital-acquired infections. I highlighted a few key points in his presentation. It does state that 1 in 20 patients have an infection related to hospital care at any given time. And healthcare associated infections are approximately $3 billion annually. So this is, $30 billion annually. So this is a big cost that's happening in the hospitals that we need to reduce down. Not only that, patients' care are getting, compromised, and their stays are becoming longer, complications with their stays. So let's see. He defines the most common or the most likely to happen, and these are the catheter-associated urinary tract infections. Again, this is when you have a Foley catheter inserted and you develop a urinary tract infections after the insertion. So this can happen from not doing proper sterile technique when on insertion, or caring for them properly, or even removing them in a proper time. Central line associated bloodstream infections. Central line is a very sterile technique to place. Most of the time doctors insert these, and in the emergency room, we see a lot of times doctors do insert these in a sterile technique, but in an emergency situation, and it's so important to provide sterile technique to these patients, but in the instance that they don't, they can give them a bloodstream infection. And then ventilator-associated pneumonia, and this is what we talked about before with the ventilator not being properly cared for. So they can categorize them into age and sex. I'm going to just explain to you that this CAUTI is what an acronym for the catheter-associated urinary tract, and out of 2,449 hospital-acquired infection, 52.8% of them were catheter-associated urinary tract infection. And the most at risk for those were females, which makes sense because women have smaller urinary tracts. And it's just more common for women to get these infections. And then he just wrote a few things about postoperative pneumonia. MRSA, C. diff are a few other hospital-acquired infections, and they have lower rates. He also looked at age, and he felt that there was not really specifics on age unless you associated them with their underlying clinical conditions. For instance, women with cardiovascular disease are more at risk for pneumonia. Okay, we have another article that I did here, and this is Approaches of Preventing Healthcare Associated Infection. And this author looked at prevention. He looked at two methods, vertical and horizontal. Horizontal looked at reducing pathogens, and vertical looked at surveillance testing and identifying carriers and preventing transmission. Examples of that, vertical, would be isolating patients with MRSA, which would prevent other patients from getting that infection. For instance, if they had a new surgery, an open wound, they would be less likely to prevent that. So that's one of his approaches. And another one was vertical, which was reducing pathogens, and they did that mostly by hand hygiene, gloving, and decolonization. Okay, my next article was by Lowe. Okay, and he looked at strategies to prevent catheter-associated urinary tract infection. This is by far my favorite article because he looks at prevention measures. I'm just going to read off a few of the slides here because I felt like he made great points with this article. UTIs is one of the most common hospital-acquired infections. 70 to 80% of these infections are attributed to indwelling urinary catheter. People the most at risk have neutropenia, renal disease, and smell sex. Healthcare professionals' hands can transmit infection to people with Foley catheter drainage bags, and the bag itself is a reservoir for infection. The first guide to help reduce these infections were removing Foley catheters as soon as possible, especially if they're unnecessary for the patient, and they were the prompt removal of unnecessary catheter reduced UTI rate by 53%. Hospital staff education. This slide here is my main focus for my research proposal. Hospital staff education on placement, management, and removal was implemented into the study. This education resulted in a decrease in catheterization rates from 18 to 9.2%. So this is one of my strategies that I'm going to be doing, and I'll explain that to you later on. And then the last article I did was about copper surfaces reducing the rates of healthcare-acquired infections. And then this basically, the study was done in an ICU, and they did the study using copper alloy bed rails, over bed tables, intravenous poles, arms of visitors' chairs, call buttons, and computer mouses. They did weekly samples of 6 objects. Compared with that, among patients admitted to non-copper rooms, the proportion who developed hospital-acquired infections and or colonization with MRSA or VRE was significantly lower among patients admitted to copper rooms. So that's a great source for reducing hospital-acquired infections. Of the 4,450, 545 bacteria recovered during the trial. Only 17%, rather than the expected 50, were isolated from rooms with copper objects. So those are some great points by this author. Okay, so this, I'm going to explain to you my research question, and this is what I'm doing for my research proposal. What measures does a hospital in southwestern Pennsylvania need to do to prevent hospital-acquired infections from happening to people who seek this hospital for good quality care? I will be using a qualitative research project over a 30-day period to gather data to help prevent infections from happening. The reason I decided to do qualitative research over quantitative research was because my study is small. It is I'm doing this study in a hospital in southwestern Pennsylvania, which is a 341-bed hospital. I want to look mostly at the patient's needs. I will be using surveys to gain insight on how to prevent hospital-acquired infections. I'll be looking at the behavior of the staff who care for patients with hospital-acquired infections, and I want to find evidence-based nursing to reduce hospital-acquired infections, and that is why and what I'm doing for my research proposal at this hospital in southwestern Pennsylvania. My sampling procedure will be conducted over a 30-day period from April 1st through April 30th. I'm going to be using convenient sampling, and that means my sampling will be convenient for me. I will have everybody in my hands at the hospital who have a hospital-acquired infection. I will be able to access their medical records and get that information from them, and I will obtain this information to help myself find which patients are getting these infections and what infections they are getting, and how I can use prevention measures to prevent these from happening. And I'll explain that. My instrument that I'm doing this sampling procedure will be 2 ways. I have an infectious disease nurse that is already involved in the patient's care. She will be doing a surveillance of every patient that comes into the hospital that have received hospital-acquired infections. She will classify them in which infection they have received. She will then put that in an Excel spreadsheet and put the most common to the least common and email that to me. I will then see which infections are the most prominent in our hospital. For instance, if urinary tract infections are number 1 on that list, I will be using that information to help our education department understand that urinary tract infections are our #1 infection in the hospital associated to your hospital-acquired infections. So I will use their team to help guide and develop educational, what am I trying to say? Educational classes for staff at the hospital to help reduce these infections from happening. And they will find ways on how we can better prevent these from happening by, is it our equipment, is it our staff not removing them properly, are they inserting them without sterile technique? So that will be the first line of defense I will be doing there. On the other end of it, I will be using surveys. These surveys will go to mostly volunteer staff. No, not one staff member has to fill out this survey, but we ask for volunteers on the medical floor to fill out these surveys. They're in the Likert scale, ranging from questions of strongly agree to strongly disagree. And these questions will ask, do you feel that you perform the best hand hygiene to every patient each time? If, however, we get these surveys back and we're getting strongly disagree, agree, strongly disagree, we'll take the average of those and look at those measures as well. If, however, we are getting a lot of information back and getting high averages on staff feeling that they're not performing the best hand hygiene, and it's because they don't have convenience of the hand hygiene. So we can put more Perel bottles around the hospital, or we can simply put another education into place about the importance of hand hygiene. I remember when I first started nursing, we had a big issue with, we had a surveillance where an infectious disease nurse would be around and she would look at us and see if we were cleaning our hands, and we would never know if she was there, and we were getting poor results from that. So we had the infectious disease doctor come in and show us this video of how the color, and it basically showed a nurse not washing her hands and how she spread this infection to a healthy individual. And from then on out, I was very cautious of my hand washing. And that's what I want to kind of give to the people here at the hospital in southwestern Pennsylvania. The advantages of this will be from the surveillance, because all the data we are collecting is going to be accurate. It's every patient that comes in, what infection they received, and we'll have that in an Excel spreadsheet. However, we will get some disadvantages from the staff, I feel, mostly from their honesty. Are they going to truly tell us that they don't feel that they're performing hand hygiene? So we're hoping that we get honesty from the staff so we can better suit our patients and find better ways of prevention measures. All right. And then again, this is the same thing I went through again about the reliability of our surveillances and surveys. And we'll be taking the averages from the surveys of how the staff feel, and not only will they be asking the question, do you feel that you perform the best hand hygiene with every patient? Another question would be, do you feel that when you insert a Foley catheter, you perform sterile technique at all times? We'll be getting the averages from those from the Likert scale, and we will be taking that information and putting it into our education department. And I think that is a very strong attribute to the prevention of urinary or from hospital-acquired infections. And that is what my outcome will be. My goal is to find what we are lacking with hospital-acquired infections and how prevention measures we can put into place to help reduce these infections from happening to this hospital in southwestern Pennsylvania. I'm looking to suit our patients and give them the best possible care to not only them but to our future patients. And I hope to get this information from this research project and from this great prevention measure that I have in place. Do you guys have any questions?
You started this project?
It started April 1st.
Okay.
I still have the infectious disease nurse getting all that information. Once I get that within a 30-day period, if, however, we only get 5 patients within that time frame, I will extend the study for another week and see if we get more patients. And then once she's done with those 30-day period and surveillance them on which infections they have, then we'll place the surveys into place with our staff at the hospital.
And is your hospital supporting you?
Yes.
They
Yes.
are, okay.
Yeah, it's very, well, the infection, it's all volunteer. So the infectious disease nurse is already surveillancing these patients anyway. So she's honestly just doing an extra step for me to get this information. Once I get the surveillance of who is the most at risk, then everyone that I ask to fill out the surveys will be on a volunteer basis, simply because I don't want anyone to feel obligated to, I want my message to be put out there about what I want to do, so I'm hoping that I will get a lot of volunteers, but you know, it's a sticky situation because, you know, it's about how they're providing the care to the patients. So, but I want them to understand that I'm using their knowledge to benefit the patients and to prevention measures. So, do you have any questions? No?
I do have one more.
Sure.
I've heard in the past people get upset because they go to the hospital and they get sick and they come out. So this would help that, right? Because I had sick while I was in the hospital, people say. So,
Yeah.
okay.
And that was my biggest thing when I started this project. I'm like, people are coming here to get better. We shouldn't be getting them sick. And, you know, from all the research I have done, it is because of, you know, not only staff, but there's other people that are sick in the hospital. And, you know, our hands and can be the #1 cause of spread of infection. So, you know, it's important that we continue that education on hand hygiene, gloving when necessary, and giving that patient what we told them that we were going to give them from day one, which is the best care that we possibly get to get them better, to get them out of there. So that's what